The best thing about X39 is it absolutely works, and you're about to hear an extraordinary benefit from our good friend, Dr. Mike Murphy. If you wouldn't mind, Dr. Murphy, click your camera, unmute yourself. Dr. Murphy is a Notre Dame graduate. He did his medical school at UCLA. He went on to do his residency at Yale University, and then he went on to become the head of spinal surgery at Yale. So, Dr. Murphy, we are thrilled that you decided to participate with us. And if you wouldn't mind, just share a little bit about your initial thoughts on this little sticker. What about photobiomodulation and what it's done for you and your back? Dr. Murphy, welcome to the program.
Well, thank you for having me, Joe. It's a pleasure to be here and be with all like-minded people. Let me back up a little bit. Mike McCoy and I were freshmen at Notre Dame in 1966, and we lived in the same dorm, and we're friends, but we're not like best buddies. We joined a weightlifting club by a renowned Notre Dame priest called Father Lang. And so we used to lift weights there in Father Lang's gym. And this was a time when weightlifting was not really pushed on athletics. It was felt that it made you muscle bound and slow and not a very good athlete. And Father Lang had a totally different approach. And he kind of changed the whole concept of strength training in athletics. But at any rate, so I've known Mike for well over 50 years. And, we went our separate ways for a while. He went to the NFL, obviously. I went into medicine. And then we reconnected, probably about 15 years ago to honor Father Lang. And we had a reunion and we put some money together and created a major bronze plaque and put it in the new Notre Dame strength facility, which is an amazing facility. And then I started working with Mike in his ministry. And he called me up one day. I mean, I've had a few medical problems along the way. For years, I had a degenerative back condition where I had a pinched nerve in my lower back. And that would require me to get something called an epidural steroid injection about every 6 months or so. And that would get rid of the pain, but it never completely solved the problem. So I'd have to go back every 6 months and repeat the whole process. Being a spine surgeon, I was totally familiar with all the problems associated with spinal surgery and didn't really want to have it myself. So I kept doing the epidurals. It was working, but it was a major nuisance. One day Mike called me up and he said, I got this new technology called the X39 patch. And he says, I've been using it and it's been a wonderful thing for me. And, at first I was kind of skeptical, but I knew Mike well, and, he's a straightforward, upstanding guy, totally honest. And I said, you know what? If McCoy's using this and he's getting good benefits, what do I have to lose to try it? And so I started it. And, in all honesty, it took a couple of months for me to notice a big difference. But all of a sudden, my back and leg pain went away. And I haven't had to have an epidural steroid injection in probably 2 years now.
Wow.
And I do feel that it's made a difference in terms of my my strength. I go to the gym 3 times a week and work out. I think it's made a difference in terms of my energy level. I think it's made a difference in terms of my, of course, I must admit I've never had trouble sleeping, but I sleep like a baby now. So all things considered, I think it's been a very positive influence in my life.
Oh, that's
Yeah, Mike is
outstanding.
on my ministry board for many, many years, so I appreciate and he was very instrumental in getting me into almost all the Catholic schools, Mike, in the state of Connecticut. You know, with his busy schedule as a spine surgeon and up in Yale when he was an active doctor, he would make the phone calls to these principals and set these schedules up. And we must have done that, I would say, over what, a 6 year period, 3 times through almost every Catholic school in Connecticut. So thank
Yeah.
you for that.
All my pleasure. I think we actually talked to over 5,000 students, Mike.
Every year, every time we did that, I know. Yeah.
Hey, Dr. Murphy, my cousin is an eye surgeon, and she sent me an article, and we're talking about stem cell injections and the risk, how risky they are because you don't know the source of where that stem cell is coming from. That's not like X39. X39 is a sticker that's going to regenerate your own stem cells. But the reason I bring that up is it risky or dangerous to continue to get a steroid shot or an epidural if that continued on?
It is to some extent. There are, like anything in medicine, there are pros and cons.
Hmm.
And the steroids are a miracle anti-inflammatory medication, but it comes with a price.
Yeah.
And the price can be an increased risk of impairing your immunity, which then would potentially lead to infections. It leads to thinning of your skin, which can lead to easy bruising, easy lacerations. It can lead to some damage to the lining of the spinal canal itself. So there are some drawbacks to it, but all things considered, it is at least for me, it was a major benefit as an alternative to spinal surgery.
Mm-hmm. So you're a big fan of this little sticker now, right?
I am, yeah, I'm sold. I think I'll be wearing it until it's time to say goodbye.
Oh, fantastic. Dr. Mike Murphy, thank you so much for joining us. McCoy, thank you for introducing me to him. What a fantastic testimonial.